Hello and welcome. The topic we will be presenting on is patient-centered care. I, Emily, will be presenting alongside with Nicholas, Ayush, Felix, and Zoya. This presentation will discuss the background on patient-centered care, how to incorporate it into healthcare, current programs in Canada, some international, and discussion questions at the end.
According to Ontario Medical Association, a patient-centered care system is one where patients can move freely along a care pathway without any regard to which physician or any healthcare provider, institution, or community resource they need at the time. This system is such that it considers individual needs of patients and treats them with respect and dignity. The ultimate goal of patient-centered care is to build relationships between physicians, families, and patients, thus leading to enhanced quality of care and patient satisfaction. So let's talk about some benefits of patient-centered healthcare. So the process itself is very difficult to measure since it involves a lot of different views, perspectives, and attitudes. It is often also made difficult since there's a huge number of doctors and physicians that do not share their collected data. So when benefits are calculated, they're often calculated by looking at factors such as customer satisfaction, and that is predominantly through surveys. What was found through these surveys was that there is an increase in patient satisfaction just because more patients felt like there was communication between the physician and the patient, so they felt more involved in their own process, in their own treatment process. There was also better financial performance, just because the treatments were so precise and catered to the patient's needs. Everyone knew exactly what to do, and so it eliminated any unnecessary processes or use of equipment that would further take up more finances. There was also an increase in employee satisfaction, and this is because everyone knew what they were doing, there was more communication going on, and there was less confusion, leading to employee satisfaction. Increased healthcare outcomes. Again, everyone was involved. This included patient, families, healthcare providers, and so this leads to very precise and very catered treatment, leading to, targeting the patient's needs, so resulting in better healthcare outcomes. Let's talk about some obstacles which lead to patient-centered care. One of the main obstacles is patient practice methods. And although it's changing now, primary healthcare physicians are paid poorly per every encounter with a patient. This causes the physicians to increase their patient volumes, ultimately reducing time that they spend with each patient. This also leads to increased orders of unnecessary tests and prescription of medication that can be avoided, as well as a long time. This also ensures that the patient often visits the physician, thus the physician's making more income, and ultimately lowering the health quality.
Healthcare, plain and simple. Patient-centered care. When you need medical care, you just want your doctor to make you feel better. In a perfect world, your doctor's office would stay in touch with you, the hospital, and any other specialists or healthcare professionals who treated you. So everyone would be on the same page, working together to keep you healthy. Unfortunately, we don't live in a perfect world. Right now, doctors are generally paid for every service they provide, so their payments are based on quantity instead of quality. And in fact, it can lead to tests and screenings we don't need. A lot of doctors are frustrated with the current setup too. It doesn't allow them enough time to give us the care they want to give us. But there is hope. Across the nation, including right here in Hawaii, more and more doctors, hospitals, health insurers, and the government are working together on solutions to change the way healthcare is delivered and paid for. One of the promising changes is called the patient-centered medical home. No, it's not an actual home. It's a better, more coordinated way of doing things, so we get the right care in the right place at the right time. In the patient-centered medical home model, our primary care doctor leads a team that works together to keep us healthy. If our doctor decides we need more ongoing or specialized care, they might refer us to a specialist, a nutritionist, or a wellness coach. The patient-centered medical home way of doing things is a big deal. Doctors and hospitals will get paid for keeping us as healthy as we can be, instead of getting paid for every test and procedure they do. The more doctors, hospitals, and insurers work together, the more they can help us stay healthy and stop healthcare costs from spiraling out of control. Of course, the most important person in patient-centered care is you. Remember, for all these changes to work, you need to take an active role in your own health and well-being too. So maybe we don't live in a perfect world, but lots of folks in the healthcare community are working hard to make it better. To learn more about the patient-centered medical home, visit healthcareplainandsimple.com.
Now we're going to talk about incorporating patient-centered care. Across Ontario, patient-centered care is now becoming the central focus in Ontario's healthcare system. This is because patient satisfaction and expectations have not been met, and more individuals are unhappy with the clinical services that is offered to them. But on the contrary, patient satisfaction has increased in the past 7 years, but it hasn't increased enough to create a change, a significant change. Especially now with the growing population, according to Stats Canada, client surveys indicate that patient-centered satisfaction has not increased patient experiences. Many medical professionals working in the field have just been taught to focus on prescribing the treatment for the ailments that occur to the patient. But they lack patient satisfaction and their needs on what may make them more satisfied. Patient-centered care should be taught and implemented in a medical school curriculum and should focus on three aspects: the patients, the teams, which includes the clinical and the hospital staff, and the systems. Implementing patient-centered care at a medical institution level will allow us to improve the communication skills of both patients and the healthcare professionals and the healthcare teams which provide the care, which in turn improves patient satisfaction. Incorporating patient-centered care in a medical institution has 5 advantages. It helps attain better financial performance, increases employee satisfaction, raises hospitals and clinics' rankings, and improves patient health outcomes, and in turn improves the shares for the hospital and clinic and shares due to better patient satisfaction and rating. There are 3 teaching methods which will help incorporate patient-centered care in a medical curriculum or a medical institution curriculum. The first one is didactic education, second one is focus on stories, and third one is patient and families act as mentors. Didactic education is a teaching method which has a central focus on theoretical and moral knowledge and is an essential method when it comes to teaching a class of number of students. Because patient-centered care focuses more on the individual, meaning the patient, and through didactic education, graduating health professionals should focus on interpersonal skills, communication between them and the patient or the client, and education strategies which promote trust, partnership, self-management, and identification of properties to engage the patient to enhance the quality and safety. Incorporating patient-centered care should include sharing of literature reviews and best practice models with tips and strategies as shown in the image below. The second teaching method is focusing on stories. Focusing on stories allows the healthcare professional to connect emotionally to patient-centered care. Though it is not feasible for the healthcare professional to make decisions based on emotions, but it is important for them to be more empathetic in a way so that they understand the patient's needs. Stories of successful patient-centered events allow to create human connections and also sparks motivation amongst the healthcare professionals to focus on patients and their well-being. University of Michigan Medical School, UMMS, found that 61% had memorable stories to portray, with 38 being positive stories and 40 being on the negative satisfaction stories. Focusing on stories will also help healthcare professionals differentiate between being empathetic and sympathetic. Teaches them how to feel sorry for someone and how to put themselves in someone else's shoes to experience their struggle. The third teaching method is patients and families which act as mentors for the graduating healthcare professionals. Using patient mentors who are living with chronic conditions can have a great impact on the method of education and how we teach the graduating healthcare professionals, and also how they learn patient-centered care. The advantage of having patient mentors for these medical students can also help medical students engage in honest dialogue. Honest dialogue will help them interact with their lives and become more involved. It is mainly about their illness, the healthcare team, and the healthcare system and how it interacts with the patient. Having patient mentors will also help the healthcare professional understand the signs, symptoms, and complications of the disease through the patient's eyes. It allows them to be more empathetic.
Current programs for primary patient care. In Ontario, there are 4 different types of primary patient care teams. The first team is known as Family Health Teams. FHTs are interdisciplinary teams with composition and size that are based on community needs. They are led by family physicians. FHTs are generally composed of 10 primary care physicians and 7 other healthcare providers, but teams can range in size from 1 physician to 50, and large networks of FHTs may include 116 physicians. There are currently 150 FHTs in Ontario. Approximately 1.9 million Ontarians belong to FHTs, and 250,000 of whom did not previously have a family physician. The next primary patient care team is community health centers. Community health centers offer interdisciplinary care with physicians, nurses, social workers, and provide primary health and health promotion programs. CHCs improve primary health care by targeting specific populations. These include high-risk or vulnerable populations. The next teams are family health networks and family health groups, which consist largely of groups of physicians who work together to deliver comprehensive care to their patients. These practices provide after-hours access to a nurse through a telephone advisory service. Are the programs making a difference? There is currently a mix of patient-centered care in institutions that are unfortunately disconnected from one another. Additionally, more research needs to go into assessing patient health outcomes, preventative care targets, patient satisfaction, and key performance indicators. However, the vision for the future of family practices in Canada is patient medical homes. PMH is the idea that every family practice across Canada offers seamless care that is centered on individual patients' needs over their lifetime and are integrated within other health services. By adopting this concept, there is an opportunity to help Canadians understand that the initiatives taken for primary care unfolding across the country are focused on each individual, not just the system, and the people who provide services.
Major changes occurred within the National Health Service within the United Kingdom. After an inquiry was launched about the Bristol Royal Infirmary experience, a significant number of infant deaths occurred after heart surgery within the late 1980s and early 1990s. Although there were many unsafe practices involved and discovered in the inquiry, one of the major recommendations of the total 198 was to include patients as active participants in their own care, involve patients or their parents in decisions, keep patients or parents informed, improve communication with parents or patients, provide patients and parents with counseling and support, gained informed consent for all procedures and processes, elicit feedback from patients or parents and listen to their views. To be open and candid when adverse events occur. These recommendations can be applied to all areas. For example, physicians thoroughly explain the side effects of medications rather than just handing over a paper prescription. Similarly to the Bristol report, Winnipeg experienced a similar situation. In 1994, 12 children died after cardiac surgery in Winnipeg Health Sciences Centre. The patients and families were not treated as part of the process and thus did not receive the standard of care expected. This report also raises issues of informed consent. Were parents properly educated by the staff? Were they given options of second opinions? Had there been more understanding among patients and hospital staff, better decisions could have been made which could have saved the lives of the children. In conclusion, patient-centered care has some challenges with implementation and unity across the entire Canadian healthcare system, but there is more evidence being recorded that shows its effectiveness in improving quality of care. It is continuing to become more internationally recognized as a mandatory part of healthcare practice due to some tragic incidents. So it's important to learn from past mistakes so that the present and future patients can receive the best and highest quality of care. To achieve this, patient-centered care must be incorporated into all levels of education for all healthcare professionals. Please read over these discussion questions and think about your answers. Can you recall any experiences of patient-centered care or lack of patient-centered care? What do you feel are some challenges with implementing and maintaining patient-centered care? How could you make patients more aware of their role in patient-centered care? Thank you for watching our presentation.